Hello, I am dentist, Dr. Hasan Aydilek. I am the medical director of Sanita Health Group. I have been a dentist for 23 years. After graduating from Istanbul University Faculty of Dentistry, I received training in oral implantology at various institutions abroad. I have been working in oral implantology for about 20 years, specifically in implants and implant-supported prosthetics. I have been successfully working for about 20 years in specific areas such as full mouth restorations, implant treatments requiring advanced surgery, zygomatic implants, and the All-on-4 technique. Recently, we have been working together with PlaSurgery. I perform the necessary implant treatments for their patients. Our prosthetic specialist friend handles their prosthetics. In our clinic, we use the robotic implant technique while performing implant applications for all our patients. Robotic implants are placed. Before the surgery, we use a computer program that determines the ideal implant diameter and length by placing it in the most accurate location of the bone based on the patient's 3D tomography. We place the implants in the correct angles and locations on the patient's tomography in a virtual environment, targeting the areas of the bone that are the densest. Therefore, we enter the surgery knowing what size, what length, and from which area we will place the implant for our patient. In most patients, we can perform our surgery without cutting any gum tissue, simply by creating just enough space for the implant to enter without any stitches and without bleeding. However, in cases where we will work with a normal open approach, we can open it very slightly, thus completely reducing the patient's complaints such as swelling, post-operative pain, and bleeding to zero. Another technique we use is called the All-on-4 technique, which allows us to treat patients with advanced bone loss without the need for bone grafting. This technique involves placing 4 implants at an angle in the anterior region of the jawbone. We have been using this since around 2006. In this way, we have treated many of our patients. It provides a significant advantage, especially for patients coming from abroad, because when our patient arrives, we are able to complete both the implant and, in most cases, the prosthetic restoration on top of the implant. In situations where a second visit is necessary for the prosthetic restoration, we do not send our patient away with a removable prosthesis. Instead, we provide them with a fixed, non-removable temporary prosthesis that feels like their own teeth. Since there is no need for bone grafting in this technique, the surgery duration is shorter. It also results in a more economical cost. One area I specialize in is implant treatment with zygomatic implants. Zygomatic implants are a technique we use in cases where the upper jawbone has completely resorbed, particularly in patients who have used removable dentures for many years, and where the All-on-4 technique, bone grafting, or other bone surgeries cannot be performed. In this procedure, we place 2 implants on one side and 2 implants on the other side, totaling 4 zygomatic implants, or we can place 2 zygomatic implants and then insert 2 or 4 regular implants in the anterior regions, providing our patient with a treatment alternative where we can also fit permanent teeth. We have been successfully applying zygomatic implants for about 10 to 12 years.